Good morning, it's 9:13. You probably recall colorectal cancer being in the news last month after 48-year-old actor James Van Der Beek died from it. Actor Chadwick Boseman, who is best known for his role in the Black Panther movie, he died from it in 2020. He was just 43 years old. Now, it used to be that colorectal cancer primarily impacted people over the age of 50.
But now it is the leading cause of cancer death in Americans under 50. March is National Colorectal Cancer Awareness Month, so we invited our medical doctor, Archelle Georgiou, to come in. We wanted to talk with her a little bit about prevention and symptoms and treatment and why we're seeing it in people that are so young, because I think, so many of us associated it with folks who are older.
Yeah, it's not an older person's disease anymore. In fact, since the 1970s, the rate of colorectal cancer in young people, which, by the way, is defined as people younger than the age of 50, has gone up about 2% per year. And so now we're seeing that of all the colorectal cancers, in young people, it's 10 to 14% of cancers. And so it's certainly much more common in older people, but we're not immune.
What is going on? What are the theories as to why younger people?
So thanks for using that term, theory. We don't really know, but there are assumptions, and that it's a multitude of things, and it's probably has to do with lifestyle, obesity, our Western diet, sugary drinks, smoking, alcohol, inflammation, and all of those things combined might affect our microbiome, right? All of the organisms that are in our GI tract that could set us up for colorectal cancer. We just don't understand it completely. And we also know that there are people that are higher risk because of family history and genetic links. But in terms of why this explosion, we're not exactly sure.
Let me ask you a follow-up on that. Did it have anything to do with that there are seemingly easier detection methods now than maybe there were 20 years ago?
That's such a really good question. And the answer is we don't think so. And here's why. Because if we were seeing so many more because of screening, then it would affect the percentage of cancers that are in different locations. And that's not the case. So we're just seeing more cancers. And we're finding them earlier. And that's why the guidelines changed to have colonoscopy and colon cancer screening happen earlier.
Makes sense.
Can I ask you a clarifying question? Because I feel like I hear people talk about colorectal cancer and colon cancer kind of interchangeably. Are they the same thing?
When you talk about it, you can use the terms interchangeably.
Okay.
But let me tell you that location matters when it comes to colorectal cancer. So a colon cancer that is on the right side of the colon, which is on the left side of your screen, will behave a little differently than if it's on the left side, which behaves differently than if it's in the rectum, okay? And you can see the percentages of how often those occur in a younger person. So younger individuals, meaning less than 50, have a different distribution of where that colon cancer shows up. It's primarily in the rectum and mostly on the left side of the colon. Rectal cancers are more likely to be aggressive, and here's why. It is that the tissue in the rectum is less thick than in the other parts of the colon. So the cancer has a thinner wall to get through and can metastasize more easily. And so that's really important. The other thing I want to point out is that anal cancer, like what Farrah Fawcett had, completely different disease altogether than colorectal cancer. You don't even put it in the same category because that's driven by a viral infection, the HPV infection.
Okay.
Yeah. I know.
Sorry, that was just a lot, and I'm seeing the diagram, and I'm trying to figure out.
I want to ask you. I don't want this question to sound inappropriate. It might be medically, but so if you hear you've got one of those versus the other, are you like, oh, geez, that like
is one worse than the other?
There's automatically a greater severity, or?
And are you referring to colorectal cancer versus anal cancer?
I guess
completely different diseases.
Yeah.
Treated very differently.
Okay.
And a colon cancer, people can't choose, of course, where they're going to have that cancer, but it will make a difference if it's in the rectum versus the right side of the colon. And it's also harder to treat.
I was going to ask,
on the left side, especially, you know, it's a smaller area in the rectal area. It's a thinner tissue. There's more organs. It's more difficult to preserve colon function with rectal cancer. So it's treated differently.
How do you know if you've got some of the symptoms? What are the symptoms?
So there are hallmark signs that everyone should pay attention to. So any blood in your stool or black stool is really, really important. Do not assume that it's hemorrhoids or that it's nothing. Always get it checked out. Bowel habit changes, and that means you're having more frequent bowel movements, less frequent bowel movements, or a change in the caliber, the thickness of your stool. Another big sign. Persistent abdominal pain or cramping, any unexplained weight loss, and then an iron deficiency anemia, which you wouldn't know if you had that, but if your doctor did a blood test and they said you have an iron deficiency anemia and there's no other reason to explain it, it would be a reason to look into this as well.
What are the parameters? Because we've already talked about like the having a colonoscopy and the Cologuard and the different types of things. When does that start for people again? Didn't they change the guidelines? Doesn't it start younger than it used to?
Yes, they changed it a few years ago, and they lowered it from the age of 50 to general screening for the average risk population to be at age 45. However, if you have a family history, if you have a genetic predisposition, or if you have inflammatory bowel disease, which is like ulcerative colitis or Crohn's disease, then you need to talk to your doctor about getting screened earlier.
Well, Archelle, thank you. This is, it's top of mind, obviously, when you've got what I consider these young guys dying of this, but it's important for everybody to be thinking about, no matter what their age is.
And certainly not something people talk about very often, so it was nice to have you
And I didn't
on
mean to stun you with some of the facts, but I wanted to highlight the differences.
Well, it's shocking, and I said we don't talk about it, so it's nice to be able to get that information.
Great. Thank you.
Thank you. For more medical news and how it impacts you, make sure you check out Dr. Georgiou's podcast. It's called Speak Up for Your Health, and we'll be sure to post a link to episodes on our website, minnesotalive.com.